This is how you do bad science. Researchers looked at the relationship between trans fat and saturated fat intake and the risk of developing various chronic diseases, including heart disease, diabetes, and cancer. They found that intake of trans fats is associated with all three. That's consistent with other research and is not what we will be talking about today. With respect to saturated fat intake, they did two different types of statistical analyses. In the first, they did not adjust the data for any special circumstances. They just compared saturated fat intake to disease risk. Not surprisingly, they found that intake of saturated fat increases the risk of all-cause mortality, heart disease, cancer, and type 2 diabetes. That's consistent with other research as well. So why the controversy? Well, the researchers did a second type of statistical analysis in which they adjusted the data for people who had high LDL cholesterol. Essentially, that means that people with high LDL were removed from the data set because having a high LDL is known to cause heart disease, cancer, and type 2 diabetes. So it would seem to make sense to exclude those people who already have a known risk factor for these diseases. Here's the problem. Saturated fat consumption is the cause of high LDL cholesterol. So by removing people with high LDL, you are removing people with high saturated fat intake. It should come as no surprise then that in the second analysis, they found no link between saturated fat intake and disease risk. Of course not, you just removed all of the people that would have shown that link. But this is the real problem with all of this. Check out the news headlines covering this research. The abstract of the paper only reported the adjusted results, even though the paper itself included both results, one of which emphatically confirmed what we already know, that saturated fat intake causes heart disease, cancer, and type 2 diabetes. This is how you do bad science.